So my name's Laura Mamounas, and I'm a program director at the NINDS. So Rett syndrome is a severe, devastating, but rare neurodevelopmental disorder that occurs in about 1 in 10,000 female births, and it's usually caused by mutations in the MECP2 gene. So the MECP2 gene is located on the X chromosome and encodes methyl CpG binding protein 2. We call it MECP2, which binds to methylated DNA and has a very important role in regulating gene expression at the local and global level. The majority of affected individuals with Rett syndrome are females. And females are, because the gene is on the X chromosome, females with Rett syndrome and other X-linked disorders are mosaic for the mutation. So about half of their cells are normal and the other half have the mutation. And this is because of a phenomenon known as chromosome inactivation. So Rett syndrome is very unique. The girls, apparently have a normal course of early development. And then around between age 1 and 3, they start to show some developmental regression or stagnation. And the core symptoms of Rett syndrome include a progressive loss of previously acquired spoken language skills, development of stereotyped repetitive hand movements such as hand wringing, and a loss of fine motor skills, including walking in some cases. But there are many other features. Girls can have cognitive impairment and breathing abnormalities, and the breathing can be a really severe and even life threatening condition. So, this is characterized by irregular breathing, and the majority of the girls have this, and it include rapid breathing, breath holding, and or air swallowing. Seizures, anxiety, sleep, gastrointestinal, and orthopedic problems are also, part of the symptoms that these girls have. And a subset of girls with Rett syndrome can show autistic features, but it's not seen in most of the patients. Interestingly, and this is true for almost all neurodevelopmental disorders that are genetic, there's a high degree of variability in clinical severity. For example, some girls may have a severe loss of language and unable to walk, where others are much more mildly effective. And there's several reasons for this. It certainly is due to the nature of the mutation, where the mutation is occurring in the MECP2 gene, but it also could involve skewing of the chromosome inactivation. There can be genetic modifiers in other parts of the patient's DNA that can make the symptoms worse or less severe. And then environmental influences can play a role. So for example, behavioral interventions such as physical therapy and language therapy and environmental enrichment have the potential to reduce some of the functional deficits in Rett syndrome.